Hello everyone, it's Mimi here. BMS working in the NHS. And today's video will be about carbohydrates, glycoproteins, and mucins, which is part of the IBMS specialist portfolio in cellular pathology. So, just a quick introduction to this video. It will be short and sweet, I promise. I will discuss indicative repertoire, knowledge requirements, competence requirements, reflective statement, evidence of achievement, Q&A suggestions, supporting evidence ideas, and some helpful tips that can make your portfolio really good. With all that said, I hope you will enjoy the content of my video and I hope you will learn a lot. So let's dive into the subsection. The portfolio offers indicative repertoire for this subsection that includes PAS, AB, ABPAS, ABPAST, toluidine blue, Jones methenamine silver, GCDFP15, CEA. Knowledge requirement is what it is expected of you to know and understand to demonstrate your knowledge is at the specialist level. Think about what knowledge you had as a Band 5 BMS. How would that differ to the knowledge as a Band 6 BMS? That specialist level of knowledge would allow you to troubleshoot, problem solve, verify, validate, help others and maintain high-quality service. Let's have a look at the first knowledge requirement is for you to know the application and principles of carbohydrate demonstration. What carbohydrate demonstration methods do you use in your practice? What are their principles? How can results be applied in clinical setting? How would you troubleshoot them? Consider the stains highlighted in the indicative repertoire and stains used in your department, their application and principles. The second knowledge requirement is for you to know the principles of the pathophysiology of carbohydrate formation and the pathological significance of variations of expression of carbohydrate. What is the principles of carbohydrate formation? Consider glycogenesis and gluconeogenesis. What is the role of carbohydrates in health? What is the pathological significance of variations of expression of carbohydrate? Consider glycosylation, protein function, cell-cell interaction, immune response. Consider expression in cancer, metastasis, invasion, immune evasion, cell signaling, proliferation, biomarkers, metabolisms, diabetes, obesity, and cardiovascular diseases, atherosclerosis, genetic disorders, congenital, and inflammatory diseases. The third knowledge requirement is for you to know the types of carbohydrate present in different tissues. What types of carbohydrates can be present in tissue? Consider glycogen in liver, skeletal muscle, mucins in GI, respiratory tract and mucous membranes, glucose in brain and blood, glycolipids, and glycoproteins within cell membrane. The fourth knowledge requirement is for you to know the principles and practice of routine staining and impregnation methods for the demonstration of carbohydrate. What demonstration methods would you use to detect carbohydrates? What are the principles and practice of those staining methods? Consider the stains highlighted in the indicative repertoire and stains used in your department, their principles and practice. The fifth knowledge requirement is for you to review cases and material microscopically for internal quality control and external quality control. How would you assess quality of relevant demonstration methods? What control material does your laboratory use for each demonstration method? How would each demonstration method be assessed by an assessor? Consider color balance and consistency, specificity of staining, uniformity of staining, presence of background staining, contamination or deposits, presence of nonspecific staining, UK NICA's assessment criteria, control material used, documentation. The sixth knowledge requirement is for you to know the key clinical conditions where these demonstration methods may be of diagnostic value. What clinical conditions can be detected by using demonstration methods for carbohydrates, glycoproteins, and mucins? What is their diagnostic value? Consider cancer, metabolic disorders, infectious diseases, Sjogren's syndrome, autoimmune skin diseases, pulmonary alveolar proteinosis. The seventh knowledge requirement is for you to know the risks and hazards associated with carbohydrate demonstration methods. What are the risks and hazards associated with carbohydrate demonstration? How would you minimize them? Consider health hazards, physical hazards, environmental hazard, disposal methods used, risk assessments, regulatory bodies like COSH, HSE, or Ritter, substitutes available to reduce risks and hazards, preventive measures like PPE, ventilation, waste segregation, and safe handling. Competence requirement is basically a combination of knowledge, skills, and experience one needs to perform a job to a satisfactory standard and level. Your chosen evidence should demonstrate these competence requirements. The following competence requirements need to be met for this section. The first competence requirement is for you to follow demonstration method protocols accurately and safely. How do you perform relevant demonstration methods in your lab? Do you use manual or automated method? How do you know you are following the demonstration method accurately? Consider SOPs, method used, quality control, use of control material, training, competency. The second competence requirement is for you to select and use the correct staining or impregnation method to demonstrate carbohydrate present in different tissues. What staining methods do you use to demonstrate carbohydrates in your laboratory? How would you perform them? Consider the stains highlighted in the indicative repertoire and stains used in your department. The third competence requirement is for you to select and use the appropriate control materials, maintaining appropriate audit trail records. What control material do you use for each demonstration method? How do you maintain audit trail for control material used? How do you produce appropriate control material for each demonstration method? Consider tissue type and availability, verification, validation, record keeping, traceability, audit trail. The fourth competence requirement is for you to use appropriate microscopy techniques to visualize methods. What type of microscope do you use to view relevant demonstration methods? Consider light microscopy, magnification, Kohler's illumination, digital. The fifth competence requirement is for you to identify stained carbohydrate present in different tissues. What types of tissue express carbohydrates? How would you identify them? Consider microscopic examination of stained slides, demonstration method used and the target carbohydrate, your training and competence. The sixth competence requirement is for you to assess stained sections for quality. How would you assess quality of sections stained with relevant demonstration methods? What steps would you take? How are those slides assessed during EQA assessment? How do you maintain appropriate audit trail record? Consider color balance and consistency, specificity of staining, uniformity of staining, presence of background staining, contamination or deposits, presence of nonspecific staining, UK NICA's assessment criteria, control material used, documentation. The seventh competence requirement is for you to resolve any problems associated with the staining method, including root cause analysis, as appropriate. What are the common problems associated with relevant demonstration methods? How would you resolve them? How would you record them? Consider investigation, problem identification, corrective actions to fix the issue, preventive actions to minimize problems from reoccurring. Consider possible problems like poor staining intensity, poor specificity of staining, artifacts like uneven staining, hazy slides, presence of deposits or precipitate on the slide, reagent contamination, and so on. The eighth competence requirement is for you to dispose of waste reagents safely. How do you dispose safely reagents used during relevant demonstration methods? What disposal risks are associated with those reagents? Consider licensed contractors used by your lab, waste segregation, safety data sheet of reagents that often state disposal ways, risk assessments, local policies, and regulations that are followed, health and safety risks associated with reagents like flammability, corrosivity, environmental toxicity. Each section also contains reflective statement which is asking you, the candidate, to summarize your role in the laboratory in the context with each section. When you complete all the subsections within this section, you will be required to write a reflective statement. You also need to write a personal reflection on your training and why you chose your evidence. To prepare for that, write a smaller reflective statement for each subsection. What is your role in context of this subsection within the laboratory? What does your evidence demonstrate? Also write a smaller justification as to why you chose your evidence for this subsection. Also write what was your training like when it comes to this subsection. Writing a smaller reflective statement at the end of each subsection will then make it much easier at the end of the section. Each subsection also has evidence of achievement. This is a part where your training officer signs you off as competent and fit to practice as a BMS at the specialist level. Training officer will confirm that you can work in accordance with local SOPs relevant to this section. They will also confirm that you have answered questions set by them to test knowledge and skills relevant to this section. And they will confirm that your chosen evidence demonstrates your competence relevant to this section. You will need to be signed off as competent by internal assessor for this section. This can be your training officer, senior BMS overseeing this section, or a training lead. Questions should be set by the training officer. They need to be based around the knowledge requirements relevant for each subsection. They should allow the candidate to demonstrate their understanding in each subsection. The questions should be specific and relevant to the candidate's in-house practice. They should also allow the candidate to demonstrate their specialist knowledge. If you would like to see specific example questions, please have a look at the video for trainers. Link will be included in the video description. These are some ideas for supportive evidence you will have to submit to demonstrate your competence in this area. Some more ideas for supportive evidence to demonstrate your competence in this area. Some more ideas for supportive evidence to demonstrate your competence in this area. I would also like to share with you some helpful tips that can make your portfolio look really good. Try to present the information in various formats such as tables, pictures, photographs, diagrams, flowcharts, graphs, or even videos, if you can. This nicely breaks down a lot of text that is usually present in specialist portfolios. Try to make it a little bit more interesting to the reader, which will be your training officer and eventually the assessor. Try to put yourself in their shoes. How would you like to read hundreds of pages of plain text? There is a saying I really like, and it goes like this: a picture is worth 1,000 words. I will make a video. I will share with you my evidence I used for my portfolio back in the day. Hopefully that will help. Also try to use various types of evidence, not just one type, like case studies for each subsection. You could use experiments, case studies, annotated results, annotated photographs of you performing tasks, evidence of troubleshooting, annotated EQA results, nonconformances, validation and verification as comparisons of different approaches and their pros and cons, control material production, certificates of course attendance with reflective statements, annotated images or charts, and so on. Try to bring in your personality. Think about the ways you like to learn best. If you like experimenting, perform experiments. Like troubleshooting, perform troubleshooting. Choose something that demonstrates your understanding, knowledge, skills, and how you apply this in your practice. And one more thing, keep the competence requirements in mind when you selecting your evidence. Good evidence will tick off several requirements. And this brings me to the end of today's video. Hopefully you now have a better understanding about the knowledge and competence requirement for this section. And I hope you also have a better idea what evidence you can choose to demonstrate your competence. And my final take-home message? Keep those requirements in mind when answering questions and selecting your evidence. Bye for now.